Today we are covering the interpretation of laboratory values, a topic the NCLEX loves to test through priority and clinical judgment questions. It's not about simply knowing that a normal potassium level is 3.5 to 5.0 milliequivalents per liter. The exam wants to know what you will do when you see a value of 6.5. Let's consider an exam question where you have a patient with chronic kidney disease whose potassium is 6.2. The options might be to document the finding, recheck the lab in an hour, administer the patient's scheduled beta blocker, or notify the healthcare provider immediately. The correct answer is to notify the provider. This value is critically high and poses an immediate risk for a fatal cardiac dysrhythmia. The exam trap here is choosing a passive or delayed action like documenting or rechecking. The NCLEX tests for the most immediate life-saving intervention. Another favorite is sodium. If a question describes an elderly patient with a sodium level of 120 who is confused and has a headache, what is your priority? The answer will relate to safety. This patient is at high risk for seizures due to cerebral edema. Your priority action is implementing seizure precautions. The exam will try to trick you with options about administering hypertonic saline or encouraging fluid intake. But immediate patient safety from injury always comes first. Now let's think about the complete blood count, specifically hemoglobin and platelets. Imagine a scenario with a patient who is 2 days post-op from a hip replacement. Their hemoglobin was 12 grams per deciliter yesterday and is 8.5 today. This is a significant drop. The NCLEX question will force you to connect this lab value to a potential complication, such as internal bleeding. Your priority is to perform an assessment focused on signs of hypovolemia, like checking blood pressure, heart rate, and looking for overt signs of bleeding. Don't just pick the option to document the result. You must assess and interpret the trend. For coagulation studies, let's use a patient on warfarin for atrial fibrillation. Their latest INR result is 4.0. The therapeutic range is typically 2 to 3. An INR of 4 means the blood is too thin, posing a high risk for bleeding. An exam question will ask for your best action. You should hold the next dose of warfarin and notify the provider. Administering the medication would be a critical error. The common mistake is thinking you need to wait for more signs before acting. The lab value itself is the critical sign. Here is a simple phrase to remember for potassium, which is often the most critical electrolyte tested. Potassium pumps the heart. Any deviation, high or low, can cause life-threatening cardiac issues, making it your priority to address. The NCLEX isn't just a test of knowledge, it's a test of judgment. For lab values, this means seeing the number, understanding the risk it represents, and taking the correct priority action to keep the patient safe.